Hello, I'm Ryan Ferdyhart, and this is the Clinical Ethics Corner. Medical ethics is always a challenging and complicated field. The very nature of the field is to provide assistance and support in the most difficult situations and to provide guidance into what is the most ethically supported path forward. It carries enormous responsibilities, mainly through the idea of moral authority, meaning being viewed as an example of morality and someone who will be believed and respected simply because of who that person is. Which means in this career and in my experience, it is always best to prioritize compassion, humility, and empathy over everything else. My ability to connect with people on a personal level has been the solution to many clinical situations over my knowledge of philosophy, ethics, and rationality. For example, we had a patient who was in her early 80s. She was unresponsive and dying of breast cancer. She was failing all of her swallow evals and was not able to take food orally. She had two children, a son and a daughter. And the son was saying that she should have a feeding tube, a peg tube, surgically placed. The daughter was saying this is not something that this patient would want, that she would rather her have a more comfortable passing. So there was disagreement. I was asked to assist as an ethicist. I worked with the family and discussed, and during my discussions with the son, I realized something just wasn't connecting medically, and it was more deeply personal. I asked him, why do you want your mother to have a feeding tube? It was that question that changed the conversation. He said, well, he wouldn't want his mom to be hungry. He wouldn't want her to be experiencing hunger while she's passing, even though he knows it's not something that she would want. We discussed the nature of death, how it is likely that patients are not experiencing hunger when they're this critically ill, and how we have medications and ability to treat that hunger so that she wouldn't feel this while she was passing. He became fully supportive of the plan, moved forward, and everything went according to plan. Being able to connect with that son personally is how that situation was improved, rather than the medical or the philosophy. So taking that example, how could this patient situation have been improved earlier from having this approach? How did my approach of humility change the situation away from being more aggressive and more forward? And did this family need a moral authority or a supportive presence? As ethicists, we fill all of these roles. Sometimes we are deep thinking philosophers. Other times we are compassionate and supportive people. Sometimes patients are looking for us to be the one responsible, the one that has to make that hard decision. Other times they're looking for us to give them permission to do what they feel is right. It is a challenging field, but also an extremely rewarding one. Thank you. I'm Ryan Ferdyhart, and thank you for stopping by the Clinical Ethics Corner.